Hello and welcome to The Public Good. This is Deja James with Partnership for the Public Good, or PPG, which unites over 380 organizations across Western New York to make a better Western New York region. We are an organization that does policy, advocacy, and research, but right now we typically only do advocacy on the state level and then locally the city and county level. But we would be remiss, as I said in our last episode, to not be talking about the federal government right now. And so I'm doing a series of episodes about implications of federal policy that do impact us locally, but that we need to be looking at the national level. So last week we had on Anna Porter from the New York Immigration Coalition talking about immigration enforcement, talking about changes in immigration legislation. And this week we have Jasmine Westbrook with us from the Healthcare Education Project to be talking about Medicare and Medicaid, and really be talking about the attack on our healthcare systems, to be honest. And so I'm just so excited to have you on, Jasmine, but I'm going to let you introduce yourself to everybody so that we can really get into this conversation.
Well, first off, thank you for having me. So again, my name is Jasmine Westbrook. I am a healthcare advocate with the Healthcare Education Project. We are a joint effort of the Greater New York Hospital Association and 1199 SEIU, which is a healthcare labor union. So we have a unique position where we do a lot with the community, but also labor. So it's like a great blend of that. And do you want me to dive right into
Please do.
Okay.
Let's just start talking about it, because people are scared right now. They think their benefits are going to go away.
Yes.
There's some stuff that's already been kind of eliminated. What's the current state? What are people facing right now?
Okay, so last week we were in DC in the front lines. That was our second visit to DC to meet with the congressional members. I met with the first visit, we met with Congressmember Kennedy, Congressmember Mannion, and then a staff of Congressmember Tenney. At those meetings, we saw who were the allies and who were not. We already knew ahead of time when it comes to healthcare investments, specifically for Medicaid, is what our fight is. And so our second round of visits were all with the Republican leaders who voted against or who voted for the cuts, I should say, the $880 billion cuts that would impact Medicaid. So Medicaid is not the only thing in that, but it's a huge chunk. And so this time around, our visits, the Congress members did not meet with us. We were able to meet with the staff for Congressmember Langworthy, who covers some parts of Hamburg and then the southern tier heading to the Erie PA border. And we did not get a visit scheduled, even though we tried, with Congressmember Tenney, who covers to the right side of Niagara Falls, more rural areas, heading over to central New York. But we still had our members and our community constituents who attended the lobby visits with us still go into the office and speak with the staff and tell their stories.
Absolutely. And this is, and one of the biggest things I want to talk about with this topic specifically is it's such a bipartisan impacting issue, which I think people really don't understand. There's a lot of Republicans, there's a lot of veterans, there's a lot of people on all sides that use Medicaid. And so for that to be under attack, some of that is the constituents of the current administration.
And that's what we are trying to really highlight, those voices. So when we came to DC just last week, this second visit, we made sure we were strategic, making sure that the membership of 1199 of our healthcare workers reflected of those voices. So making sure that we had registered Republicans, people who live in rural areas, so they knew that these are their constituents and these are issues. And they work in it, but a lot of them have personal stories as well that they shared, whether it's themselves having to be on Medicaid, a family member, someone that they're caretaking for while still working in the healthcare field.
Yeah, absolutely. And I don't know if you're able to talk about any of those personal stories or just what you've been hearing as the impact of cuts and even threats of cuts are made, because even before cuts are even happening, healthcare institutions, places are kind of preparing and cutting back services, cutting programs and things already, like before they're even seeing the, depletion of dollars. So what impact is that having in community that you're seeing and hearing right now?
So I could kind of take us back to like our state level campaign, which bleeds into the federal level. So on the state level campaign, we've been fighting this fight. It is a 4-year fight. We're in the 2nd year, and really urging Governor Hochul to increase the funding for Medicaid, because in New York State, Medicaid reimbursement is 70 cents per dollar. That's like going to the grocery store without any coupons, filling up your cart and saying, my cart costs $100, but I'm just going to pay 70 and y'all going to have to be okay with it.
Wow.
And so that's what's going on with our Medicaid system in New York State. And so between the first year, we did get some improvements, about like a 73-74% reimbursement rates increase. Our goal was over a 4-year period to increase it to 100%, but we're shifting our fight to not only be on the state level, but also on the federal level, because we understand that she's in a compromising situation now. If I'm getting cuts to my pool of money, how can I even try to attempt to increase it? And so we have that dual fight going on.
Yeah, and we're seeing that across, like I said, we do advocacy on the state level for a lot of different issues, and it's hard to ask for anything right now because they're so scared.
So many issues.
They don't even know if they're going to be able to like provide school lunches and stuff like that. Like it's to that point of we have to deal with kind of the first response stuff, like basic needs are under threat of not being met.
Housing, clothing, healthcare.
Yeah, it's terrifying. And I just feel like a lot of people, they want to see these big changes. They want to see, federal government has to change. They have too much oversight, whatever. But I don't think they really understand what the dismantling of these systems do, especially when there really is no real plan of like replenishing or replacing any of those systems. It's just, well, let's just get rid of it all. And I don't know, privatize. I don't know what the actual alternative that they're proposing is.
Because we're still going to need healthcare coverage if we want to be a healthier community. And so it's like eliminating the funding that provides care to so many New Yorkers or Americans is not the answer.
No. And I'm not surprised that you couldn't get meetings with certain folks.
We weren't surprised either, but we're going to do our due diligence and try our best. But we still bring the constituents that live and work in their areas there. We bring members of 1199 and also community members and clergy every time we do a visit. So good wealth of our community just sharing their voices, sharing their stories, and making it as personal as possible.
And what is the perspective, since you are coming from that unique perspective of labor and 1199 and healthcare workers, what is the perspective of healthcare workers on these issues? What are kind of some of their fears or what they're seeing that's making them, participate so heavily in this movement?
So there's a fear of, am I going to lose my job? In some areas, in Niagara County, for instance, there's only one hospital where women can deliver babies. So depending on where you are in Niagara County, you might have to go across to another county to deliver. It could be a 30-minute drive. Most people don't have that type of time when you're dealing with a healthcare crisis. Wow. And so that's due to service line closures. There's possibly closures of safety net hospitals because they're highly dependent on that Medicaid reimbursement. And so that's scary to not be able to get the healthcare treatment that you need in that amount of time. Another thing that I've heard from some of our healthcare workers is the quality of the products that they're using has to change. And so I guess it's similar to like, you have your favorite brand of tissue.
Right.
But if you had to use the generic brand, it could still work, but it's not the brand you want.
Right.
And so in some facilities, they even had to double back on that and lower that quality of care, still providing adequate enough where it's not illegal, but not the quality that they would want for their own self or for their loved ones.
The change of the level of quality of care is huge too, because we already know in our communities that the level of care already isn't that high.
Yes.
And where are we disproportionately, people on Medicaid and things like that. So to have to lower the quality of care in communities that already struggle to find quality care, people will die. Like, it has a way larger impact than just, oh, well, maybe you can't go to the hospital you want, or maybe you have to wait in a long line. I think people think, oh, well, it'll just make things harder to attain, but we'll still be able to get them. But if hospitals have to completely close, if clinics have to completely close, if they don't have enough supplies or things like that, that's a way larger issue.
Yes. And even with the clinic piece, with clinics closing, you'll have more people using urgent care or emergency rooms as a primary care source. And that's just increasing the number of people that'll be waiting, increasing the workload on the medical staff. And that's just a disaster.
It is. And we saw that especially during the pandemic. And, when they were like, don't come to the emergency room with anything but COVID at this point, right? And there were so many people. I have family members that their go-to is to go to the emergency room. They don't really have a primary care doctor because they don't know where to access those services and things like that. And there's so many locally based, medical providers that really try to be for a community. And, I've already heard a lot this morning about folks being laid off and people laying off 50% of their staff and all of these different things. And that's, like you said, across housing, across all of these different areas.
Scary times.
It really is. And then now we have all these people that are unemployed who probably now need Medicaid.
Yeah, and that's the thing. Not to deter too much off of the subject, but with a lot of the federal employees no longer having their employment, or people just having to downsize, that is a situation any of us could be in.
Yep.
Like, we're all thankful for the careers that we're in, the jobs that we have, but any day we could get into an accident. We could lose our job just because we got a notice.
Yeah.
Like, you just never know. And you could be in that situation where you have to rely on Medicaid. Yeah. And I really believe that as a society, we're losing that empathy to be able to think about other people's situations because we're not going through it at that time. Yeah.
And, people definitely take advantage of job security or different things of that nature, especially when you're a civil servant or you have a state job or you have one of those, you know how our people are. It's like, you get a government job, you good, right? And
I work for the county.
And right now, they're losing some federal dollars that they thought was coming from the state, but oops, it was coming from the federal government to New York State, and they're laying off whole departments, county, state, all of that. And so, and I just want to read a statistic really quick, because it says in March of 2023, there were 47.6% of New Yorkers that were under some type of Medicaid enrolled plan, including children and family plans. But that's almost 50% of the entire state of New York that is using Medicaid. It's
crazy to think that the legislators that are in charge of these decision making can't think of their constituents like that. It's just really sad.
I think, and because we take a lot of elected official meetings, and I think the thing that muddies the waters for them so much is, they're trying to get reelected, or they don't want to be in the news about anything. And I get it, to a degree, they have to make concessions. There's a balancing act, and I get it. Like, if you want me to be here to be good, I got to try and be here. And I get that. But I will also implore, because I feel like as voters, as constituents, one, we need to show up. So please, please, please show up to the polls. But the second thing is, the media and social media and stories really have such a huge influence over people now, whether it's true or not sometimes. And so we really need to be discerning. We need to be more discerning about and really look into the information that we're ingesting, because it does implicate our decisions, or even make us kind of apathetic to even wanting to go to the polls. Like, well, my vote doesn't matter anyway, or things like that. And I'm hoping, platforms like this and many others and advocates like you, Jasmine, are able to kind of bolster community a little bit more. Like, no, this is the time where we need to be really doing something because but I just find so many people are disengaged in a way that's like they're just checked out. Like, whether
it is overwhelming, it's a lot of things going on, and it's hard to maintain your regular day-to-day life while hearing of all these different issues. And I understand, like, if I didn't work in this work, I probably wouldn't be as observant to the different news stations and all of that, but you know, it comes with this territory,
right?
But it can be very overwhelming, but we can't let that defeat us.
No, absolutely not. And I don't know if it's the same for you, but like, I feel like doing this work helps keep me going, because I'm like, at least we're trying to do, we're putting up a fight. Like, we're not just going to roll over and take it, right? So in that vein, I'm wondering, kind of, you said that this is kind of a 4-year campaign. There was a 4-year plan. What is that plan? How can people be engaged in that plan with you all? How can they be kind of supporting your efforts as you're advocating both on state and federal now levels?
So one of the big things that we do is mobilize voices. So we have our Share Your Story campaign, which is a part of the Medicaid Equity Now, where we have a website and you can just upload your video right on there, a 60-second video, and say why Medicaid is important to you and your community. And from that's actually how I was able to bring a community member to lobby with us in Albany this past March. And a little bit of her story is she is a full-time working mother. She does not receive Medicaid herself, but she did adopt 2 children. One of them is kinship, and one of them was like a family friend. They both came from backgrounds where the mother was using substances. And so they have some mental health conditions, and without the Medicaid, she wouldn't have been able to care for them because her private insurance didn't give the same type of mental health coverage. And so her story is so powerful because it debunks the idea of people saying that people on Medicaid are lazy, people on Medicaid don't want to work. Like, that, this is children who need it. And because of that, one of her children are now enrolled in college, and one of them is doing really well in high school. And who knows what their path would have been if they did not receive that mental health treatment, which was funded by Medicaid.
And I'm not, embarrassed to say, like, I come from a family where we were on Medicaid for large swaths of time, and sometimes my mom would land in a really good job, and it was perceived as a good job, but then our insurance coverage, it was not adding up. Like, just because she was making a little bit more money doesn't mean she can pay all these co-pays, doesn't mean that we are having the same access to care as what we were having. And so that discrepancy is so interesting to me, because I feel like to your point of people's argument of, oh, well, people on Medicaid are lazy, but the alternative sometimes really isn't better, at least not when you first get over that poverty line threshold of, oh, well, you make a little bit too much, but now where am I stuck at? Right. I can't actually access any care. How can I get to the
next level without some support? Another community partner that I actually brought with me to a Medicaid teaching we were doing, that's another way that people are able to be a part of the Medicaid Equity Now campaign. It was actually hosted by the minority leader, Jeffries. And so I brought her with me, and it was great because she's a full-time working mom as well, but her job does not give her benefits. So for herself and for her children, she has to have Medicaid. She works 40-plus hours. Sometimes she's working on the weekends. And so it's like, where do those people fit in, and how can they get the help that they need? They're a part of helping our economy.
Right. They're holding it up. I mean, at the end of the day, like, these are the people holding up the entire system. Because if people are unwell, if people, need services or whatever jobs they're working, like, other people aren't working that many hours, working that hard. So it seems like an obvious conversation for us to have.
It does.
And so that's where I get, like, a little exasperated, because to your point of, trying to find political allies and just having common decency when they're thinking about constituents and things like that. It's like, who would make an elected official the bad guy for supporting
right
healthcare?
Well, when it's going against a body of people who just aren't worried about what is best for the constituents, and they're worried what's best for their pockets.
And I know the debate, it always comes down to like, oh, we want to pay less taxes, and then if we all have more money, we'll take care of ourselves.
We're going to pay for it one way or another. Nothing in life is free.
There's nothing in life is free, but it's like, do people know how much medical care costs for real in real life? Have you
looked at, if you did not have health insurance, how much a simple prescription would be?
I don't think people look at that invoice sometimes and see how much the insurance covered versus what you ended up paying. Like I've had a couple of different medical procedures over the past few years, and I was like, that cost how much? Right. That cost how much? And so you getting a couple extra $100 back in the tax return is not going to cover, you know what I mean, that cost. And there's so many people that aren't able-bodied, and especially as we age, I'm figuring that out. Like I took my health a little bit for granted, you know what I mean? And I know, especially from our community, I think now more than ever, people are getting checkups and going to primary care doctors more than they ever have in the past. But I know sometimes we go with the mentality of like, oh, well, if we have to, we can go without, right?
Or even when you think about, depending on what a person's copay may be or any deductibles, that could be, am I going to pay this bill or am I going to pay to go to this primary care service? And that's what a lot of people have to think of on a day-to-day when they're working paycheck to paycheck, making ends meet. And so those are other decisions that I don't think are being factored. It's like, it's not that people don't want to be unhealthy. I mean, people want to be healthy. They don't want to be unhealthy. No one wants to be sick.
Right. And of course, like if I could get treatment or I could get the medication and it be done, like who wouldn't want that? Right. But sometimes it's just not as easy.
I was like that when I worked for an agency that had a high deductible plan. I went to one specialist one time and I was like, oh, I'm not going to another specialist.
I'm not. Like
I can't afford this.
I know. No, literally, like I've had family friends like probably tear the ACL, do something crazy, and they're like, well, I'm gonna wear this knee brace and we gonna go to work.
Like, we gonna make it work.
That's it. Like, and so systems like this are what help people, not totally deteriorate their bodies. I mean, and if we don't have a healthy population, like who are going to be our teachers, who are going to be working in a grocery store, who are going to, even mailmen, stuff like that. Like, what would we do? So it's just a collapse of healthcare is a collapse of a lot of different other systems.
It is.
And so I hope our listeners understand that and want to kind of help advocate to uplift this issue. I don't know if you guys all have people calling, their representatives or things like that to be pushing. I also want to plug, even though it may be past by now, but we're recording this. It's going to come out next week, but on Saturday too, there's going to be like a Buffalo United march.
So I'll be there.
Okay.
I'll be speaking about healthcare, specifically Medicaid, and a call to action.
Absolutely. And the Buffalo United March, for those who may not know, and I when this comes out, that may have passed already, but there's going to be some more action items after that. But there's this large march happening in Niagara Square and Buffalo, but it's also happening in a lot of other cities across the nation. It's like this national day of uniting action. of action, exactly, for Medicaid, for immigration, for oh my gosh, all different types of housing. I mean,
environmental issues, just
anything that's under attack right now, because obviously it's everything. It's really everything, which is why we're doing all these different episodes on these topics. But I don't know if there's anything else you want to share, Jasmine, just with people, how, they can get involved, what they should be saying to each other. Because I think the other thing is, like, how can we activate each other to, like, take more action?
Talk about it. I think that's where it starts. Like, even within my friend group, we talk about issues now, and we're always like, oh wow, we're really the real adults now. Like,
yeah, that's the thing. Because before it's like nobody want to talk about politics, nobody shut up. But now it's like
we were exchanging our primary care and our OBs and our group text, and I was like, I'm proud of us. That's good. We need to have these real conversations, and we were like, this doctor is good for this. This one we felt like was a little bit more empathetic, and having those real conversations, and it could be as simple as a quick text message, even if you're uncomfortable having a face-to-face conversation. But we have to talk about it, because I don't think, especially with the Medicaid issue and healthcare issue, I don't think people realize how close it hits to home for them.
Yeah. And I love what you're saying there in terms of like just the progress we've made as a community, because I've had that same conversation of, or I even posted on Facebook, like, does anybody know a good primary care doctor that will actually listen to me? Like, Black woman, somebody that'll listen. And I've gotten so many responses like that sharing about our systems, our health, and things of that nature to support each other. Even like, you know, there's like Psychology Today for therapists and stuff like that, but there's like one specific for like Black therapists and Black psychologists that I've seen. And they're literally on there. It'll say like Medicaid accepted, things like that, so that people know this is accessible to you. And so for that to potentially be disappearing when we're making so much progress,
it's not right.
It's devastating.
Oh, and that just made me think too. So I'm a member of the Association of Black Social Workers as well. And this past year we launched a Black Wellness Directory in partnership with the Office of Mental Health for New York State, and also with Dat Brown Bragg. And so it's an online directory where you can see different providers, not just mental health, but like physical health, like yoga practitioners or like massage therapists. So I can send you that link as well. So
we absolutely about to put that in the description, in the comments, anywhere you watching this, because even I want to peruse that. Yes. That's such a great resource.
Yes, because we used to have so many people reaching out to our Facebook and asking for recommendations, but we will always be careful because we wouldn't want it to look like we were endorsing someone.
Right.
And so we were like, creating this directory is needed, and especially after 514, where it was so much conversation that I think was already happening, but it was just more in a public light of having practitioners that look like you, especially when you're dealing with situations that are so racially motivated. And so that's how this whole project came about. And so we just launched it in February.
That is so beautiful. I love Black people. Sorry. I just love.
I'm glad that New York State gave us money to help us. That was the hurdle, because we didn't know where to house it. And so with the Office of Mental Health having a grant to be able to house it, that was the solution. So I'm proud of us. I'm proud of the state for helping us too.
And that's huge, right? For states and our government that use our tax dollars, by the way, to be investing in a purposeful way like that. You know, that's another thing that's under attack right now, right? Is anything kind of strategically DEI equity based right now is also under attack.
I just saw the Smithsonian.
They have to change language. They can't say certain words. You know, we can't be. And if we're just talking around a point, we're not getting to that point. And we've made so much progress, and this really is just. It's such a regression. It's such a regression.
Especially coming from such a diverse place like Buffalo. Like, I grew up knowing about the different festivals, and, you know, every ethnic group has their own festival celebration, and it's a celebration. It's not.
And we support each other.
Yeah, because I'm celebrating Juneteenth or for Dingus Day, like for the Polish community.
Yep.
That doesn't mean that, you know, one is better than the other. We're just celebrating our ethnicity.
Yeah.
And so from that celebration to now be turned to an attack, it does not make sense to me.
It's terrifying. And, you know, it starts with those interpersonal, oh, well, this is other, this is different. Maybe we shouldn't be talking about difference, all of these things that turn into these larger implications of now this is what we're with. When we let those smaller comments or conversations get into our larger ideas about the world, about each other, then this is the result. And so we have to be having more real conversations with each other, because like we said, Medicaid doesn't just affect us and the Black community. It's a lot of people, and we all can relate. What was it? 47.6% of New Yorkers. Like, that's a lot of people. That's not just Black people.
Nope.
That's not just white people.
We don't even make up
That's
that much
not
in
just
New York.
we don't make up that huge of a percent. So it's really important that we are having these real conversations, factually based, about issues, so that we can understand the real implications of the decisions that we're making, who we're putting into office, and what results come from that. So I just thank you so much, Jasmine, for the work that you're doing, because I can only imagine right now just the world of healthcare and health provision, how upended that is. And so I hope you also take care of yourself.
Yes.
Self-care.
I practice self-care.
Good. That's what we're advocating for that too. PPG has a self-care series, wellness workshops, if you are not aware. So please check out the PPG website so you can be aware of what those wellness workshops are. These are all really heavy topics and discussions. And we want to make sure that we're also taking care of ourselves so that we can therefore be ready and here for the fight. So thank you so much, Jasmine, for being on the show today.
You.
I really appreciate it. I'll make sure to include any links to advocacy that the Healthcare Education Project is currently doing, as well as the directory that you mentioned that I didn't even know about before the show. So I'm going to be perusing myself after this. But thank you so much. This has been The Public Good with Deja James from Partnership for the Public Good, or PPG, uniting over 380 organizations to make a better Buffalo Niagara region. We will see you again next week. Thank you so much.